A phased array transducer with a cardiac exam type is used to perform the parasternal short-axis view of the heart. If possible, place the patient in a left lateral decubitus position to reduce any lung artifact and to bring the heart closer to the anterior chest wall. Place the transducer at the third or fourth intercostal space immediately left of the sternum. Move between the third and fourth intercostal space and slide the transducer toward and away from the sternum to identify the optimal scanning window. Assuming the short axis of the heart to be positioned on a plane from the patient's right shoulder to the left hip, rotate the transducer to adjust for the body habitus of the patient. The orientation marker will be at approximately the 2 o'clock position. As an alternative approach, this exam may be performed using an abdomen exam type with an orientation marker to the patient's left side at approximately the 8 o'clock position. The myocardium will appear gray, and the blood-filled chambers will appear hypoechoic. The left ventricle will appear as a donut shape in the center of the image. The anterior, septal, inferior, and posterior lateral walls of the ventricle can be identified. The mitral valve will be seen in cross-section. From this position, the transducer can be tilted upward to visualize the aortic valve in cross-section and downward to visualize the myocardium of the left ventricle. Note the wall motion of the myocardial segments and function of the valves.